Hi guys, today I'll be talking about preeclampsia. This is a pregnancy condition, but it can still happen even after delivery. Mostly preeclampsia happens at around 20 weeks of pregnancy. Preeclampsia is characterized by some features, which I'll use a syncronym I'll use a short form of pre from the preeclampsia, whereby this helps you to remember the signs and symptoms of preeclampsia. P will stand for protein in urine. This is when you look into a patient's labs. Then R, rising blood pressure, which is characterized by a blood pressure of 140/90, which happens twice in a day in a difference of 4 hours. Then the next thing is edema, which will see swollen a puffy face, maybe swollen hands, legs, and etc. Okay, other signs and other features of preeclampsia: you'll have headache, which will not go even if you give this patient water, you encourage rest, or even give painkillers. These headache will not subside. Then you'll have right abdominal pain on the upper right quadrant of the abdomen. Then I've said visual changes. Okay, we have types of preeclampsia. We have mild eclampsia and severe eclampsia. Mild eclampsia, it has mild features, and it is usually managed by monitoring of the blood pressure, and you can deliver this pregnant lady at 37 weeks. But a severe one, you have increased blood pressure. It will lead to eclampsia, which is now preeclampsia with seizures. Okay, then it will have the hellp syndrome. Hellp standing hellp, HELLP. That is the acronym for this syndrome. Okay, now some of the complications that are brought by preeclampsia, we've said is eclampsia and the hellp syndrome. Now preeclampsia, I've told you eclampsia, I've said it is preeclampsia characterized with seizures. That is what we call preeclampsia. Now you have identified this: my patient is undergoing preeclampsia. You've seen maybe severe, it's mild. Now we have how we can manage before that, let us go look into some of the causes. The exact cause of preeclampsia is not identified, but we have some of the things that people tend to speculate can lead to preeclampsia. That is one, obesity. Then you have, if maybe you are from the African American ethnicity, you have chronic hypertension. That one can lead to preeclampsia. Then if you have diabetes, both diabetes 1 and 2, or you have the gestational diabetes, you have multiple fetus or multiple pregnancies, can lead to preeclampsia or autoimmune disease. Now we have treatment of preeclampsia. First, we've said if it's mild, what you do is just monitor. You just monitor high blood pressure. But the other ways you can monitor high blood pressure: first things first, you have to put this patient, let us call that pregnant lady patient, to a antihypertensives. Not all antihypertensives will work in this case, but we have several which we have an acronym. This is in the case of preeclampsia. This is in case of severe preeclampsia. That is where you will manage using the antihypertensives. We have this acronym, as I was saying, LNHD, which stands for labetalol. I hope I'm not butchering that word. Nifedipine and hydralazine. Those are the specific antihypertensives that you'll use to this patient. Then, to avoid eclampsia, which I said is preeclampsia with seizures, you'll give this parent or this patient mag-sulf or magnesium sulfate. Then you will monitor. But in case of, you notice you've given maybe an excess of magnesium sulfate, you have to bind it. or you give an antidote of magnesium sulfate. This is just by the way, which is calcium gluconate. Okay, now you say you have to give Magsa or magnesium sulfate for seizures to the parent. But when it comes to the baby, you have to deliver this baby. There's some cases you have to deliver this baby as a preterm. So a preterm baby, one thing you should know is they have immature lungs. And because of that, you have to mature their lungs using meds, whereby in this case, you have to give betamethasone, okay, to mature these babies' lungs. But the most ideal treatment for severe preeclampsia is delivery, okay. The other complication, we said it is hellp syndrome. We said we have at least two, which is eclampsia and the hellp syndrome. Hellp syndrome stands for, H stands for hemolysis, E stands for elevated liver enzymes, and P stands for low platelets. For you to know your patient is undergoing the hellp syndrome, we say that there will be hemolysis, so there will be bleeding. There is hemolysis and low platelets, so you'll see bleeding, nausea and vomiting, you'll see blood vision and labored breathing. Okay, now let me repeat it again, the most ideal way of treating severe preeclampsia is delivery. And I said the best antihypertensive for labor and deliveries labetalol, nifedipine, and I hope I'm pronouncing them well, and hydralazine. Okay, point to note, this video is only for education purpose. Don't use this video as a method for you to treat your patient. This is just for education purpose. Okay, now if you need such kind of videos, kindly comment on my comment section and suggest which kind of video you'll love to see in my next video. So bye.